everyone, so let's move towards our today's topic, which is blood supply of the anterior abdominal wall. Now, we have already discussed about the anterior abdominal wall, the fascia, the umbilicus, the muscles. Now, like I said, the thing which is very much important is blood supply. Okay, so you have to remember that the anterior abdominal wall, how it is supplied. The blood supply is very much important in this region. So how the blood supply is, what is the blood supply of anterior abdominal wall? So as you know that in thoracic region, we have discussed when we were talking about the blood supply of the thorax, that the internal thoracic artery at the level of 7th costal cartilage, it will divide into two branches, superior epigastric artery and musculopharyngeal artery. These arteries will supply the intercostal spaces, as well as they will pierce the diaphragm. They will passes through the diaphragm and enter into the anterior abdominal wall, anterior abdomen, to supply the anterior abdominal wall. Okay, so like I said, I am repeating again, heart से पूरी blood supply शुरू होती है, and we have discussed that in thorax, internal thoracic region is internal thoracic artery is present, and internal thoracic artery will supply the upper intercostal spaces. At the 7th costal cartilage, that internal thoracic artery will divide into two branches, musculopharyngeal artery and superior epigastric artery, which will supply the lower intercostal space, and then it will passes through the diaphragm and enter into the abdomen. Okay, if you understand this thing, it will be easy for you to memorize the further topic in this lecture. Now, the further topic is superior epigastric artery. Like I said, it's the branch of internal thoracic artery. Okay, so it will supply the rectus sheath, rectus muscle. Okay, and it will anastomose. It will connect with the inferior epigastric artery. Okay, it will attach with that, will anastomose with the inferior epigastric artery. Okay, and some other branches are also formed from this epigastric artery, that is cutaneous branches, anterior cutaneous branches, which will supply obviously the skin, as the name indicates. If the word is cutaneous, so cutaneous means skin. So skin, the skin of the abdomen is supplied by anterior cutaneous arteries, which are the branch of the superior epigastric artery. The second branch of the internal thoracic artery is musculopharyngeal artery. So it will pass through the diaphragm and it will supply the anterior abdominal wall, which is present near the diaphragm. It will not come downward much, but थोड़ा बहुत मौजूद होगा. Okay. Now another artery is also present, that is, like I said, inferior epigastric artery. So it will also supply the abdominal region. So superior epigastric artery is anastomosing with the inferior epigastric artery. So what is the inferior epigastric artery? Now, as you know that aorta will passes through the diaphragm into the abdomen, and it will called as, in the abdomen it is called as abdominal aorta. Then abdominal aorta will divide into common iliac artery. Each right and left common iliac artery, right one will enter into the right lower limb and left one will enter into the left lower limb. Each common iliac artery will divide into internal and external iliac artery. So from the external iliac artery, a branch is formed, and that branch is called as inferior epigastric artery, which moves superior to the which moves superiorly and enters into the abdomen. Okay, and in the abdomen it will form anastomose with the superior epigastric artery, and also it will supply some branches to the rectus muscle and the muscles which are present nearby. Okay, last artery is deep circumflex iliac artery. What is this artery? Deep circumflex iliac artery is also the branch of the external iliac artery. Okay, so basically from the internal thoracic artery, superior epigastric artery and musculopharyngeal artery are coming from the thoracic region. From the external iliac artery, deep circumflex iliac artery as well as inferior epigastric artery supplies the abdomen. Okay, deep circumflex iliac artery will reach the anterior superior iliac spine, which is the part of the hip bone, and on that anterior superior iliac spine it will anastomose with the superior gluteal artery, lateral circumflex artery, femoral artery, and the superficial circumflex iliac artery. So this was the whole topic regarding the blood supply of the anterior abdominal wall. To understand the nerve supply and the remaining topics, the remaining topics of the anterior abdominal wall are present in the are discussed in the separate lecture. Till then, what you have to do is work hard, study hard, and good luck. Take care. Bye bye.